Hi, Jana. Thank you so much for coming on Thrival Nutrition Podcast. How are you doing today?
I'm good. Thank you so much for having me.
I'm so excited that you're here, and the picture on your wall is here as well.
Oh,
If
yes.
you're
He's
not seeing
joining me
this,
today.
there is a super cute kid that she has with lettuce on his head. So cute. Why don't you go ahead and introduce yourself, who you are, and what you do?
All right. I am a pediatric nurse practitioner, and I'm one of the owners and practitioners here at Neuronutrition Associates. And we are a functional medicine-based pediatric practice in Austin, Texas. But prior to starting our clinic, I worked as a nurse in pediatric hematology and oncology at Dell Children's Hospital. And then I went back to school. I got my nurse practitioner degree and ended up working in primary care for quite some time. In fact, I spent 3 to 4 years in a Medicaid clinic, and we were cranking out patients, seeing 30 patients a day. It was really quite the experience. But, I think it's when I realized that my love for nutrition and for helping people heal and really change the way that they view diet and medication, I think that that's when I really started to feel that that's what was calling me. And it just so happened that one of the people I went to nurse practitioner school with, Emily Gutierrez, she and I reconnected, and she was getting her doctorate at that point and really focusing on integrative health and integrative medicine. And she and I came back together and really decided to dive into functional medicine and kind of take this leap of faith, and started going to conferences and really finding out what this would be like to start treating patients in this manner. And so that's kind of how we evolved and how our clinic ended up opening.
That's amazing. Oh, I always love hearing the stories coming from, where you were. And I mean, how many patients do you see a day now?
I know it's kind of comical, but because our visits are so long, sometimes an hour and a half, we see 6 or 7 patients a day. So it's a huge shift, and yes, better quality and more time to listen and really hear patients and know what they're going through. So it's a big shift. But I mean, I think that foundation that I had working in that clinic was huge for me. It gave me perspective, and to see, what some people viewed as nutrition and some people viewed as breakfast, and, completely different views of what I was used to seeing. And at the time too, I was struggling with my health. And so I was also exploring the ways that nutrition could help me and then help my patients. So I think, it was in a way meant to be, but I'm glad that I had that background.
Yeah. No, the quality care that like a lot of functional medicine practitioners give is, I mean, you just really can't put a price tag on it. It's amazing.
Right.
I'd rather have that. I'd rather would feel listened to than feeling like I'm being rushed off because they have 6 other people that they got to see in an hour. Like, I mean, it's just,
Yeah.
it's hard. That's really hard healthcare, and not even just on the patient, but also the provider. Like, I
Yeah.
literally can
Right.
only imagine how that feels.
Well, I was going to say, I think a lot of people, they're on the patient side of things, but as the provider and seeing, having a 10-minute window with a patient, you're so stressed about it, and that this person needs more from you, and they need a lot more care, and they need to be listened to, but you literally cannot give it to them.
Yeah,
So
that's
it's
hard.
hard.
That's really hard. So I know your practice you've been really talking a lot about pandas. And so I'm curious what kind of got you interested in this?
Yeah, it's interesting. In nurse practitioner school, we probably spent 10 minutes learning about PANS and PANDAS. It was probably in our neuro section. I definitely couldn't tell you what we learned about it back then. And I don't think that I ever identified anyone in primary care with PANS or PANDAS. So when I dove into the functional medicine world and I started going to conferences, going to the IFM, and going to the Medical Academy of Pediatric Special Needs. And they started talking more about PANS and PANDAS. And of course, the overlap with autism, I started realizing that we're already seeing this in our practice. And this was many years ago, but started to be able to identify this more and put symptoms with this diagnosis and realize that these kids were really struggling with some big symptoms, and that, it has to do with infection. And I realized that these patients not only were struggling, but their families were struggling. And so it opened a window for me that I really dove into and loved learning about and loved helping these patients and see them improve. And so I think it just evolved after learning about it and then seeing that more patients were looking for answers. We started getting more and more patients that met that criteria.
Wow. So yeah, just let's dive into the basics. Like, what is it exactly? And why does it happen?
Right. So most people don't even know what the acronyms mean. It's kind of this funny word, PANDAS. But that acronym stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep, like strep throat, streptococcal infections. And then there's also PANS, PANS, which is Pediatric Autoimmune Neuropsychiatric Syndrome.
Okay.
And the symptoms that are associated with these disorders were actually discovered back in the 80s by a doctor named Susan Suedo. And she was actually part of the staff of the child psychiatry branch at the National Institute of Mental Health. And she was actually conducting research on childhood OCD, obsessive compulsive disorder. And so her and her team were the first to identify this new subtype of pediatric OCD, in which these symptoms that they were seeing were triggered by antibodies produced in response to infection. Specifically, they were looking at group A strep. Okay, so this can be seen as something known as molecular mimicry, which is really the body's inability to recognize the difference between self versus pathogen or foreign peptide. And so there's these cross-reactive antibodies that are produced. And so I like to tell my patients, think of it like this. You get an infection, maybe your friend has strep and you get strep. And normally the immune system starts producing these antibodies towards that specific infection to get rid of it. And then your body typically clears it and you move on with your life, right?
Mm-hmm.
In PANDAS or PANS, the body is presented with this infection. Instead of targeting it and moving on, the immune system continues to produce antibodies towards this certain part in the brain called the basal ganglia and the dopamine receptors. Okay. And the immune system is still thinking it's trying to get rid of strep, but it's targeting these receptors in the brain. So once these receptors are targeted, you have all of these symptoms that go with that. You can have behaviors like increased OCD and anxiety. You can have rages and tics, vocal tics, movement tics. These kids can start having frequent urination, or they can start wetting the bed. There's or severe food restriction or aggression, handwriting difficulties, cognitive changes in school. And so, often it looks like it's very dramatic for families, and they can literally see their child in a certain way one day, and this child gets an infection, and then they wake up and they're a completely different child the next day. And I've had parents tell me, it's as if someone came and picked up my child and replaced it with someone else.
Wow.
So it can be very dramatic and it can be very sudden. There are also the cases that I see in my practice that kiddos have been struggling with certain symptoms for some time. Maybe it's heightened anxiety or OCD, but then when they are exposed to infection or maybe allergies or mold or Lyme, their behavior and all of those symptoms can go up quite drastically. So it's very concerning. Of course, the parents are just alarmed. A lot of these kids end up in the ER, and it's like, does my child have a brain tumor? What's going on with them? It's that dramatic. Or they will end up at neurology, thinking that something is really wrong. They might end up at psychiatry. So there's a lot of times that these kids end up at certain specialists looking for answers. And, you know, the seriousness of this illness is huge.
Well, it's autoimmune. Like, I mean,
right.
anything like that, that's so concerning because our body shouldn't be attacking itself.
Exactly.
That's the goal for everything. And so
Right.
it is really crazy to see how much autoimmune, just conditions in general, have increased so much. And in the last conference I went to, which we won't really get too much into vaccines, but it was basically all about vaccines and just seeing those, you know, we always hear about autism, which for good reason, it is rising as well. But the amount of autoimmune conditions that are rising is just intense. It's really intense, and it's becoming normal.
Exactly.
Oh, Hashimoto's,
right.
like my whole group of friends have it. Like it's not normal.
I know. And I feel I'm a little biased in the sense that this is all I see. So I feel like it's very rampant, but I know that there's so many families out there in the community that maybe don't know their child. This is what they're dealing with.
Yeah.
Right. They're being told that their child needs more discipline, or their child needs psychiatric meds, or they're, you know, I mean, they don't realize that this can be an autoimmune process in which the immune system is attacking the brain.
Wow, that is so insane. So, I mean, is that why it's so misdiagnosed or just missed because it's, I mean, not a lot of doctors, because like you said, you didn't get a lot of education on it in your training. So is it because it's not really being taught and trained about?
Yeah, I mean, I think that it's not being focused on. There's still a lot of controversy over this diagnosis. In fact, there's a lot of specialists that don't believe that this exists. Some providers just aren't given the knowledge, or they haven't been educated about this. So they end up sending their patients to psychiatry or neurology or somewhere to get help. But they end up coming out of these appointments often with just a myriad of diagnoses. You know, they're told their child has oppositional defiant disorder and ADHD accompanied with OCD and anxiety and dysgraphia. And so they have a long list of all of these labels to fit with the symptoms. But, you know, there's that lack of putting it all together and saying, oh, well, this is interesting. I mean, this sounds very similar to PANDAS or PANS, and maybe we need to check for strep. Maybe we need to see if this is post-infectious. So, you know, and also I think the other part that's hard is some of the children I see don't present with this overnight decline, as I was saying. Some have been living with some of these symptoms for so long, but there is a definite difference in the child when they have an infection or when they've been exposed to an infection, that everything tends to escalate. And then, you know, the other tricky part about this is it's considered a clinical diagnosis, which means, you know, let's say you're tired and you go to your PCP and they check your thyroid. Your thyroid comes back abnormal. It's okay. You have Hashimoto's, okay? So you have it on paper that your thyroid is not functioning properly, and now I can put a name with it, and now we can decide how to treat you, right? But with PANS and PANDAS, it's mostly taking a look at the child, the symptoms. Do they meet these symptoms that are typical? Are they having recurrent and, you know, kind of relapsing and remitting symptoms, which means do they go back to baseline, and then do they end up relapsing when there's a trigger? And then kind of putting this all together. So that gets tricky, especially like we were just talking about, if you have 5 minutes with your patient.
Yeah.
Right.
Yep.
And you aren't able to sit down and kind of think through their history. And a lot of parents will come and they'll talk about the recurrent strep that their child has had, or maybe brother has had recurrent strep, or sister. And then the behavior changes. And we start to think about, okay, the timing of that is very interesting. I wonder if there's something to this, and explore it a little bit more. So yeah, I mean, it's still a bit of a controversial diagnosis. And, you know, luckily, I think education about it is becoming more common. And I don't know if you watched the 2020 episode that aired in the spring.
No.
So it focused on a family who had a child with PANDAS. So that was pretty big, right? I mean, nationwide episode. So things like that will provide information to a lot of people at once. I think get families start to thinking about maybe if their child is dealing with something similar, or even providers who are watching that, start to think about patients that they see.
Yeah.
So,
well, I feel like what you said with the controversial, isn't everything at first, isn't everything a condition diagnosis? If you were to look at the history, things start being like, oh no, like that won't work, or that's nothing. And then like,
right.
50 years later, we look back and
right.
we were talking about this when this was like not, I guess standard. And then like 50 years from now, it's like, it is. So I feel like, unfortunately, conventional healthcare does set in stone. Like if we don't have a name for it, if we don't have a treatment for it, it's not possible. It's not right. And I'm like,
right. Well, and practice, it takes, I think it's 20 years to catch up to the research.
So crazy.
And I mean, there is literature that goes back pretty far on PANDAS and PANS, but there's not gobs of literature. Now I wanted to mention the one test that we utilize often on our kiddos is called the Cunningham panel.
Okay.
And the Cunningham panel is through a lab called Moleculara, and it will actually look at these certain receptors and if they're being targeted, if there's antibody production towards these receptors. And so it can be a very useful tool. So that's something I hesitate to say that it is a test that can absolutely confirm, because I don't think that's the case. And of course, there's always false negatives that can happen. But it can be useful in some cases if you need it. And maybe that will become more useful as the years go on. And then people will stop thinking that this is just a made up disease.
Yeah. I know. I was just about to ask, like, is there any lab testing to help kind of solidify moving forward? But like you said, I think hearing the history is so important. And and now just being in grad school, and gosh, I do not miss. I didn't realize how I've been out of school for a long time. But when we were learning about like the functional medicine matrix and the timeline and all that, and I was like, that's so true, because once you actually start talking to people, they don't think it's a big deal of something that could have happened. But if you really start piecing things together, you just see this big picture and you're like, oh my gosh, holy cow. Like this is
right. You
can start to see like the trigger and, where things kind of fell from there. And I just think it's so important to like really take that into consideration. So is there we'll get into the functional natural side of it, but do you feel like that there's any like conventional therapies that are really helpful? Are they really necessary, or do you feel like natural goes a long way too? Or
yeah, so we use a combination here in our clinic, which we have the benefits of having that conventional training, but also the functional side of things. So we're able to dabble in both and decide what would fit the patient the best. But, as far as PANS and PANDAS, initially, if I were to get a patient who overnight they were replaced by a different child, I would start really exploring what caused this sudden change. And it's recommended to do a strep swab and a culture. It's recommended to even do lab work, and you can look at strep antibodies and really explore, is there an active infection going on? And it is recommended to trial an antibiotic for these kids for 30 days.
Oh, wow.
I know, not very standard, but I mean, these are the protocols that are put forth. And so, that's often what we will do. If this is a new onset, okay, there's a lot of patients that come to me who have had this diagnosis for a while. They've seen other providers, and often they are still on antibiotics. I mean, sometimes even for years. And that, of course, concerns me because for many reasons, but mostly because, as you know, the gut is so important to everything, brain health and decreasing autoimmune disease and just lifelong health. And so one of my goals is to get them off of these antibiotics and try and really start healing their bodies and addressing this immune dysfunction, because they could stay on antibiotics forever, and it's doing it's having an anti-inflammatory effect, right?
Right.
So there's something to that. Or some of these patients end up getting, maybe they're on an antibiotic, they get off, they get strep again, they flare, they're on another antibiotic. And so we talk about ways to really cut back. How can we prevent this infection? Do we need to test the whole family? Do we need to make sure that nobody else is passing this to you all the time? Do we need to talk about a tonsillectomy? Do we need to go visit ENT? Are there biofilms at play with strep? So we talk through all of that. And then, there are other conventional treatments that I can say can be really life-saving for these patients. One of them is called IVIG. It's intravenous immunoglobulin therapy. And the other one is called plasmapheresis. And these are IV therapies which help to replace some or all of the child's immunoglobulins. And it really calms down and eliminates this molecular mimicry that's going on. So we do use IVIG in our practice, and we have had great success with it in the majority of our patients. And it has really turned around some of these children, because one of the things that can happen is, like I was saying, depression, and there can be suicidal ideation in these kids, and it's extremely serious. And, at that point, you don't have time to kind of dabble in diet change and supplements. I mean, you have to make something happen quickly. So that's where these kind of bigger conventional therapies come in, but they are, they have been studied to be effective, and we've seen amazing results with IVIG. So
that's awesome. I know that steroids, that's another
steroids
one
right
to bring down. But yeah, I think we live in a really great country to have access to that if needed. Because I'm not against it either. There's a time and a place for it. If I'm in a car accident, good. I'm really happy for that. So I think sometimes it's needed for both. I think it's great that we have access to that. So bringing kind of in the functional medicine aspect of it, what do you see? What do you see with gut health? Do you see imbalances? What type of imbalances? Do you see a lot of food sensitivities or allergies? What do you see just from the big picture for a lot of people that come in with PANDAS?
Yeah, it's interesting because we like and try to explore all of that. We want to do lab work. We want to look at nutrient deficiencies. We want to optimize diet, which is something that I try to do off the bat. But like we were talking about, food restriction is a big issue with these kids, or with a lot of them, not with all of them. So you can imagine if you were to start taking out certain foods from this child's diet, who is already so limited that they might literally starve themselves or only be eating one thing per day. And I've had patients like that, living off of peanut butter and jelly, and get to the point where they're almost needing a feeding tube. And so that's very delicate, but we try to work with that, because as with any autoimmune disease, the more that you can lower inflammation, the better your outcome will be, right? Yeah. So, we always tell our patients, genes load the gun and environment pulls the trigger. So of course, this is how it's playing out in this autoimmune disease. And so we'll look at gut health. We'll do stool studies or OAT tests. We always like to look at food allergies or sensitivities and environmental allergens, because whatever the immune system can produce antibodies towards, if it's reacting to foods or environmental triggers, then that's going to raise the inflammation and the antibodies that are being produced towards that part of the brain. So if you can address those things, then you can bring down the antibody production and bring down inflammation.
Yeah. Was there anything else that Oh, there's probably so much, to be honest.
I know. I'm like, what else do we look at? I mean, so the other things are, sometimes it's not as straightforward as strep. And I said PANS. PANS is kind of I wish they would just combine them and create a new name, honestly, because the deviation isn't always so clear in patients, and parents really want to know, well, does she have PANDAS or does she have PANS? And it's really not that straightforward. I mean, even your child with strep can trigger from other things.
Okay.
And your child who maybe has Lyme underlying can also trigger from strep. So I think moving forward, I would love if we could change the name, we could combine this. But that's the other thing, talking about environmental toxins, talking about cleaning up the home, cleaning up your personal care products, making sure our water is purified and we have air purification in the house, and talking about the state of the home. Is there mold? Is there possible mycotoxin exposure? What's the history of the mom? If the mother has Lyme, do we need to be looking into that for the child? Or if we have trouble maintaining baseline with this child, do we need to be looking into some of these bigger things like Lyme? Which I think there is a big party that believes that Lyme might be underlying all of these kiddos. So it's interesting. We have a ways to go with research, but there's so much to explore and really teach the parents that it's not only about medicating with an antibiotic. It's really about trying to heal the body from this molecular mimicry and trying to bring down inflammation and stop that production of antibodies.
Yes. Oh yeah. Oh my gosh. Lyme's always makes me so nervous just because there does need to be research, but I just always hear like testing is iffy. Like we're still like working on finding tests that are actually like pretty accurate, but then how to hide. And then it's just, it just makes me nervous. I don't even think about it.
I know, it's a whole nother monster. And I've had patients, come back from certain specialists and they were told that Lyme doesn't exist in Texas, which I know for people who are battling Lyme and who have been treated for Lyme, just, oh my gosh, they throw their hands up at that. So
yes. In my world, it doesn't. No, I'm just kidding.
You don't want to deal with that.
So scary. Give us like one or two top things that someone could do, like starting tomorrow, that diet, lifestyle, anything that would help. If they feel like, of course, going to see Jana is the best option.
Oh my gosh.
But just feeling like I feel like they read about PANDAS and they're like, okay, a couple of those things really stand out, but it's not something that could change immediately before, going down the path of really knowing.
Okay. I don't know if I can limit it to two. Like there's so many things, but one of the things to focus on is lowering glutamate. Glutamate elevations in these kids seem to be a big problem, and anything that raises glutamate makes symptoms worse. So for example, foods naturally have glutamate in them, but there are some foods that are very high in glutamate. And so I start by trying, if we can, to remove those foods. And that can be things like wheat, soy, corn, dairy, your top inflammatory foods already. If we can really clean up the diet, if we can, go more towards a whole foods diet, little to no processed foods, that can help tremendously. We talk a lot about nutrient repletion and gut repair, so that can include certain supplements, but there are a lot of supplements that can help modulate glutamate. So B vitamins and magnesium and zinc, and even things like taurine or lithium orotate. So sometimes we'll employ like a collection of those. Vitamin C can be really helpful too. And during major flares for these kiddos, I often employ what I call the flare protocol, and we might even actually use Motrin and vitamin C, magnesium, zinc. We'll use a little bit of everything to try and really calm down this inflammation. But, you know, reminding parents that we really want to try to return the body to the most natural state possible. And so try to get your kid outside, get them in the sunshine, you know, get them moving. A lot of my patients, they're depressed and they feel miserable, and, you know, they've been flaring and they don't have control over their body when that happens. And so there's a lot of remorse and there's a lot of guilt. And so get them moving and get them, you know, outside in the fresh air. I talk a lot about deep breathing and meditation in my practice, because this can actually stimulate that vagus nerve to lower heart rate and lower blood pressure and help with anxiety. And in this state, I mean, the body's in a constant stress state. It's in a constant fight or flight state. So, I mean, utilizing anything that can help bring that inflammation down is important. We also use, you know, omega fatty acids and curcumin for inflammation. We recommend a lot of CBD in our practice, or LDN, low dose naltrexone. Or if my patients like this and enjoy it, I have them just go get some calming tea, some Tulsi tea, or some lemon balm or chamomile. That can be very calming, especially at the end of the day. So there's so many things, but those are just a few.
Yeah, so many. I love all the information that you shared. So where can people find you, like on the web, social media? And then can you see patients outside of Texas, or, you know, what's the guidelines with that? I'm always confused.
Right. Yeah. Okay. So we do have a Facebook page and we have an Instagram account, and those are both under Neuronutrition Associates. We're in Austin. So our patients that are in Texas, we can do Zoom appointments or we see them in person. Patients that do not live in Texas have to come in for treatment. And then, kind of a side note, we did release our book in January, which we wrote on the functional medicine approach to treating autism. So you can find that on Amazon. And although it is, you know, geared towards parents with children of autism, I think there's a lot of just basic functional medicine tips that can be utilized for anyone. So that's called the Parent's Roadmap to Autism, if anybody's interested in that.
Awesome. I know, I saw that in your office when I went in. I'm like, oh, cool. Thank you so much for coming on today. I will link all your links in the show notes, and hopefully
thank you.
Reach out if they ever feel like it, because I feel like there definitely needs to be more practitioners like you, especially focusing on PANDAS. So I appreciate everything.
Thank you, Lahana. It was great talking with you today.
Awesome.